Hello, today we're going to talk about treating spider veins. There's several different types of veins that people have. There's the large varicose veins, and we won't be talking about those today. Those are sometimes treated by different methods. Anything from treatment inside the veins to sometimes the same type of injections we're doing today to sometimes some surgical procedures. Spider veins are the tinier ones. They are the size that we usually do sclerotherapy, which is still the gold standard for treatment. Lasers can be used for veins, sometimes for large veins where they're used inside them, or sometimes for the tiniest veins. But they still don't work all that well, and they can get kind of pricey, as well as have some of their own risks. So today we're going to do a treatment with sclerotherapy, which is an injection method and is the best standard for treating this size vein. Sclerotherapy is a solution that we inject into the vein and causes it to clot off and then eventually disappear. So the solution we inject, you'll see the vein flush out, but that's not how it's going to look long term. Then it's going to clot off and take about 6 weeks before it disappears. There are some risks involved. Sometimes it may not work. If we set the solution so high to work, there would be more complications. Sometimes it can leak out. We're making lots of little tiny holes and lots of little veins, and if it leaks out, it also could be toxic for the skin or the fat and cause a scab and rarely a scar. For that reason, we're using a solution today called a Sclera, which has the least risk of all the solutions I've used in the past. Many years ago, we used saline, which had the higher risks. Then we used sodium tetradecyl for many years, which was a good solution but had a little bit higher risk. And a Sclera seems to have our lowest risk. There are some cases of allergic reactions. When the vein does clot off, it does take a while for the body to clear out, and some people have some brownish color from the pigment from the blood that takes, I've seen a rare case or two take up to a year to clear. So those are our risks involved. We're going to do several syringes of injecting. You'll feel a little of burning when we inject it today. Did you have any questions about what we're going to do?
No, I do not.
Okay, well then I'm going to go ahead and set up and we're going to treat it. All right, so we're going to treat this spider vein here. And I'm trying to get the in there, and you can see how it blanches as the solution goes through the vein. If the veins are connected, they'll get that hole set there like it just did. I'm going to wipe it with alcohol again. Treat another little one. Pause. We're going to do another one on the back of her other leg here. This a little bit larger one. And that one was connected, so it did really well. Not all of them are as connected as that, and then take care of it. Now, although it disappeared right now, tomorrow it'll look like a little clotted vein. So it isn't like you can do this and go, oh, I'll be great tomorrow. We advise doing it in the winter because you need to wear compressive stockings afterwards for anywhere from 3 days to 3 weeks. One study said 3 weeks does better. You shouldn't vigorous exercise or take a warm shower for the 24 hours after to try to make sure the veins don't open up again. And it will take 6 weeks from the fade, so it's better to come in before in the winter time and get these done rather than wait until it's hot, because you're not going to want to wear the compressive stockings, and at that time you're not going to want to look all black and blue. So how was that?
It was really easier than I thought it would be.
Okay. Did it burn a little bit though?
It did.
Okay.
In certain spots.
Okay,
Mhm.
but you could take it.
I could take it.
All right. Any burning now, or is it pretty much gone?
No. Mm-mm.
All right. Well, you just have to stick around
Okay.
a little while, just make sure there isn't the rare allergic reaction, and then we're going to have you wear your compressive stockings.
Okay.
And then it'll take about 6 weeks for these to fade.
Okay.
All right.
Sounds good.